Go.
Hi, my name is Jennifer Green. Today I'm going to talk about the importance of vaccinating to protect us against disease. And this is my audience. Count them out. Over the years, I've heard the controversy of vaccinations and the decisions some parents have made not to vaccinate. A good example of how easy disease can be spread is the case that occurred in January of this year. There were 125 new measles cases reported. 110 of those people were California residents. 35% of those had visited Disneyland, and of these 110 people from California, 45% were unvaccinated. Though the source hasn't been identified, the same genotype has been linked to an outbreak in the Philippines. So approximately 24 million people attend Disney theme parks in California, and these visitors include international tourists every year. So you can see how this could easily turn into a bigger epidemic if the trend of not vaccinating continues. In this speech, I want to persuade those who are considering not vaccinating their children. I want to discuss the safety and importance of getting vaccinated. As a mother and a nurse, I feel like I have been educated on the importance of preventative care. So I want to help those who are considering not vaccinating to explore the areas that should be considered before they decide not to vaccinate. So in this speech, I'm going to do an overview of diseases that can be prevented by vaccines, including the effects and complications that they have, these diseases. I also want to discuss the safety of vaccinations and also how vaccines are manufactured and how they work in our bodies. So the first thing I want to discuss are some of the diseases that vaccines can prevent. The first one I want to talk about is polio. It's a virus that causes paralysis, meningitis. It killed and paralyzed thousands before the vaccine eliminated it from the United States. One fact about this disease is that our 32nd president, Franklin Roosevelt, had polio, and he was 39 years old when he got it. And this is him. He was wheelchair bound after he got polio. Another disease that can be prevented are diphtheria, tetanus, and pertussis. It's a combination shot that we all receive when we get a tetanus shot. You get it after you've poked yourself or stepped on a needle. Tetanus is also called lockjaw. If you get tetanus, 2 out of 10 people die from it. Pertussis, which is also called whooping cough, and diphtheria are also covered in this vaccine. They are spread from person to person by coughing. It can be severe. It can lead to pneumonia, seizures, brain damage, and even death. The last one I want to talk, or the third one I want to talk about is influenza. Everybody thinks this is a minor thing to get, but it's spread through person to person, coughing, sneezing. You can have 102 to 104 degree fever, chills, muscle aches, and you'll miss at least a week worth of school or work because you're down. You're especially vulnerable if you're over 65 years old, pregnant, people with health problems or weakened immune systems. This really hits them hard. Thousands still die from the flu every year, and many more are hospitalized. In 1918, we had our biggest epidemic in the United States. This is just a sign from one of the people that had up in their window. This was during the Industrial Revolution when people were crowded in the streets and they knew that it was spread from person to person, but they didn't have a vaccine for it, so they were urging people to stay home. 21.5 million people died at that time, and more had died from influenza than from World War I. The last disease I want to talk about is the measles. There's a picture of the measles, a child with the measles. Most doctors in the United States haven't seen the measles. It's spread from person to person. Again, it causes a rash, cough, fever. It can lead to infection, pneumonia, seizures, brain damage, and even death. As stated earlier, it had been almost eliminated, but we stopped vaccinating, so it has returned. I want to talk a little bit about vaccine safety and myths about vaccines. This statement, vaccines have damaging and long-term side effects that are yet unknown and can be fatal. This is false. Vaccines are very safe. Most side effects are minor reactions such as a sore arm or low-grade fever. Vaccines cause autism. This is false. There was a study in 1998 that linked a possible autism between the MMR, or measles, mumps, rubella vaccination. Later, the study was found that it was flawed, so it was retracted, but the media had already ran with it, and panic set in, so less people were being immunized and outbreaks occurred. And then lastly, a myth: can I get the flu from the flu shot? You cannot get the flu from the flu shot. It's not a live virus in the shot, so you cannot get it. So the last thing I want to cover is how vaccines are prepared. The World Health Organization defines the vaccine as a biological preparation. It improves immunity to a disease because the vaccine contains an agent that resembles the disease. It's made from weakened or killed forms, and it stimulates the immune system to recognize this agent the next time it's exposed to it, so the immune system will know how to fight it. Our FDA regulates vaccines. They continually oversee the safety, and they track all side effects to keep us safe. So the overall purpose of my speech was to educate and persuade everyone to get vaccinated or to consider vaccination for our children. Vaccinations are safe. They've eradicated disease in the United States, including smallpox and polio. With increased travel to outside the United States, I think it's very important that we keep disease under control here. So I've covered preventable diseases and the effects of having some of these diseases, the safety of the vaccines, and lastly I covered how they're prepared and how they work in our bodies. So I want to persuade everyone to trust our doctors, not the internet, not the media, not celebrities. Consult your doctor, listen to somebody that's gone to medical school, and talk to them about what vaccines are important to you. This is my audience.